How you doing, folks? Hope you're keeping well. So I'm going to chat a little bit more about hip pain and GAA players. Now, this has been one of those things that has exploded over the last couple of years. Basically, how do you know if you have hip pain? So if you're a typical GAA player and you have problems, let's say you're in the gym and you have pain in the front of your hip when you squat down, or you have pain when you're driving the car on the way to training, or you have pain when you're running. And what I mean by pain is that you'd have a bit of an ache. It won't stop you enough to make you stop running, but it's enough for you to notice it. But you'll especially have pain then if you're actually on a pitch and you're going to change direction. That gives you the most amount of trouble. You can have pain in the front of the hip, you can have pain on the outside of the hip, or you can have pain deep down in the hip. And depending on where your pain is will dictate what structure is involved with it. Now, when you have hip pain, because it's such a complex joint and there's a lot of forces go through it, you're going to have more than one thing going on. There's normally what we call a primary injury and a secondary injury. So a primary injury, let's say you would injure the hip joint. Secondary injury would have been the adductor or the groin gets quite sore because the hip joint isn't doing its normal function, so then the groin gets overloaded. So what you have to consider is what started first. Was it the groin or was it the hip? And we'll tend to kind of try to figure that out during an assessment. So what I mean by the sharp pain in the hip, so think about it, if you're going down deep into a squat and you feel that pinch, or your leg turns out a little bit when you're in the chair and you feel that deep pinch in the groin, that means that hip is quite sore, obviously. Then if you have a deep ache in the hip, now this might happen if you're sitting on a seat that's kind of, your bum is below your knees, so it's very, very deep couch. You're going to start to get that deep ache into the groin or into the front of the hip. Sometimes it can refer into the back of the hip or into the side of the hip, but more often than commonly not, it's going to be in that front or in that inside groin. And then lastly, what we generally see is people that have an unstable hip. So what I mean by that, not technically unstable, but it gives way. So if you twist it a certain way, you'll feel your hip drop to one side, or you feel like you're actually going to fall down. All of these are quite common. Why did it happen? Generally because your hip doesn't have enough extension. So if you sit down an awful lot for work and then you're into the gym and you're squatting, what you're doing is you're strengthening a pattern that you're already in for 8 hours of the day or 7 hours of the day. That's generally not good because, and depending on your squatting technique of what the bar path is, where it goes down through your hips and down through your heels, or you're leaning too far forward, will dictate where the force is and what muscles you're going to use. Technique is with the squat is very, very important, but if you're having hip pain, I probably would avoid squats and start to lift more things off the ground. Some people might be, if they have hip pain as well, they'd be afraid of lifting anything off the ground because they're afraid their back might go. And the two of these are directly linked, because if you're very, very tight in front of your hip and your quads and you're stretching them all the time and they still end up tightening up, it's generally because they're weak. If the front of them are really, really weak, it's going to prevent that hip from getting what we call full extension. And that's utilizing the full use of your glutes, getting those glutes and those hamstrings to work more powerfully to propel yourself forward. Now, what happens when you're on the pitch? Yeah, sometimes you might warm up and it starts to feel a little bit easier, and then afterwards you're really, really sore. That's indicative where it's going to be a tendon. You can be quite sore in the morning with a tendon, and then again it loosens up. But then again, as I said, you have a primary and secondary injury, so it might be sore when you're sitting down during the day, so you're going to have a mixture of both symptoms. When you're on the pitch, you will probably feel that you're more confident pushing off one leg, changing direction, either going to the right or changing direction going to the left. And that's going to probably give us a little bit of a hint of what's happening. Your left leg could be the one that's giving you symptoms, but your right leg could be the one that's weak. So you have a dominant leg. If the right one is weak, your pelvis is going to drop on one side more than the other when you go to change direction. When that happens, your torso is going to go the other way, and it's going to put more shearing and compressive forces down through your hip. So what can physio do? So generally what we'll do is we'll do an assessment. We'll look at your hip range of motion. Extension seems to be the primary pattern. A lot of people will kind of come in, and next thing they want to stabilize the hip on the outside, and you're doing a lot of banded walks. But if you think about the banded walks, you're actually in a little squatted position, so you're not targeting the same amount of muscles, and you're actually targeting the front of the hip. So a lot of this comes down to technique. What we do a little bit differently is, number one, we have to restore extension. So we have to be able to get that hip up into a full extension pattern, so all of those glutes are working. Two good exercises that you can do is what we call a crab. So you're sitting on your bum, your knees are bent, and you're just lifting your bum up as high as you can. It's going to stretch and be a little bit more restrictive on the shoulders, but it will give us a good idea how high you can get that hip up, and whether it's a mobility issue or a strength issue that you're going to get into that position. Generally, the two can be linked together with mobility or strength, but it's the ability for the front of the hip to actually lengthen to allow the hip to come up. When we restore that extension, then we'll start to look at your technique of cutting and changing direction. If you need to change direction, you need to be quite stable as you plant that foot out in front of you to cut at maybe, let's say, 120 degrees. If you're cutting at anything less than maybe 80 or 90, there's not too much decelerative forces, so you're not really slowing down. So there's less pressure on the hip. But if you're cutting at those tighter angles, it's gonna put more pressure through that hip, and it's gonna be more painful. So ultimately, it comes down to range of motion, strength, and your technique in your cutting ability, which will dictate how much stress goes through that hip when you're on the pitch. It is a difficult one to get rid of. Generally, most people come to us a little bit too late after they've had the injury going on for maybe 4 or 5 months and try to play through it. But as I always say to people, have you ever heard of anybody that kind of goes, oh, I had a hip pain, then all of a sudden it went away? It always creeps itself back in, and it's good to get it checked if you want to prolong the life of your hips. There is a long history of hip surgery with GAA players, but thankfully that seems to be settling down as the science behind rehabilitation improves, and the science behind performance testing improves. So look at it, guys. Hope that gives you a little bit more insight into hip pain and what we can do. If you have any questions, just drop us a shout on this, and we'd be more than happy to answer them for you. But keep training extension, hip thrusters, crabs, and we'll hopefully keep those hips nice and healthy, and stay away from squatting. Okay, guys. Thanks very much. Take care.